Your Part D enrollment penalty. Well, if you're new to Medicare or you've worked past age 65, this may be something that you weren't aware of even existed. Now, a lot of my clients that I work with say, I just didn't know. So what exactly is your Part D enrollment penalty? Well, the Part D penalty is an additional 1% of the average Part D premium for each month that you delayed your enrollment. You pay a penalty every month for as long as you have the prescription drug coverage. Now, if you did not enroll in a prescription drug coverage when initially eligible for Medicare, and you didn't have a credible drug coverage to qualify for enrollment during a special enrollment period, then this 1% per month late payment penalty will apply to you. If you didn't enroll in a prescription drug coverage within 63 days of losing your credible drug coverage, usually from an employer group plan. Now, if your employer has less than 20 employees, it is not credible. But if you come from a big organization with more than 20 employees, chances are it is going to be, or you've had credible coverage. Now, where this comes into play is Cobra. A lot of folks think that when they leave their group health plan and they get onto a Cobra plan, that this is considered active. Now, ACTIVE actually is an acronym that stands for something in Medicare. So if you didn't have credible group health coverage and you've been on Cobra for the 36 month or the however long the Cobra plan is set up for, it may not be qualified credible drug coverage. So you may still have to pay the late penalty for your Part D plan in Medicare. Now, let's take how this works. For example, let's say you delayed your enrollment for the Part D coverage of your Medicare for 18 months. You're going to pay an additional 1% of the Part D premium. So we'll take 18 months of delayed premiums times the 1% equals an 18% monthly penalty for the rest of your life or for the rest of the time that you have prescription drug coverage. Now, this is mandated by the government. So super, super important that you work with an agent and you yourself educate yourself on the penalties that can come with Medicare. Why would you want to pay an extra 18%? Or let's say you delayed it 60 months and then found out you didn't have a credible drug plan. That's a 60% penalty per month that you're going to pay after age 65. So contact me, Alina Marchant, Saddle Up Health Plans, for valuable tips and information. Subscribe to my channel. I'm also on TikTok as your Medicare jockey. So hope to hear from you guys soon. If you have any questions, concerns at all, please feel free to contact me at saddleuphealthplans.com. My information is down below.